Welcome to Senior Strategies, Tools for the Caregiver with Amy Decker and Shayne Silver. Join us on each show where you're going to enjoy a lively conversation that's going to connect you to the tools and resources that you'll need to coordinate care for the seniors in your life. We are so happy that you joined us. Good evening. Welcome to Senior Strategies. I'm Amy Decker. I am with Senior Helpers in Boynton Beach, Florida, and we're really happy to have you.
Good evening. Thanks for coming back. I am Shayne Silver, Seniors Real Estate Specialist with the Silver Team at Keller Williams Realty, and I am a caregiver.
We have had so much fun on this little journey, Shayne, and last week was a lot of fun because we were invited to the 7-year itch anniversary party for Freddie and Dawn here at the studio, which we so appreciate that they are doing their best to make us look good, even though we've
messed up.
We've messed up multiple times, but it's been fun. And I have to say,
really
we've
fun.
met some great people. Even at the party, we met some great people. And I think we're overwhelmed with the sponsorship and loyalty of so many of our friends and colleagues and professionals that have come out that really just want to cheer us on. It just makes you feel good.
The support and the help that we've gotten has been absolutely amazing. So thank you to those out there who have been supportive.
Yeah, and we have plenty now that want to be featured on our show. So if there's something that you'd like to talk about or that goes in harmony with senior strategies, anything that you can use for the caregivers, feel free to reach out to us at seniorstrategies.pb@gmail.com. We'd love to hear from you.
Any resources you know of that we may not have touched on yet, or that you think were helpful to you on your caregiving journey, we'd love to hear about them. Please, you can get in contact with us on any of our social media accounts or on our email or on our phone number. You can give us a call.
561-800-6654.
So I have to talk a little about something I had to deal with this week. A few episodes ago, we had on our show an elder care attorney, Heidi Friedman, and we had guardianship director, Pam Weiner. And I cannot stress enough how important, and we stress this all the time, having your legal documents
in order, updated and up to date for not just you, but if you are caring for a loved one, their legal documents, anyone you're caring for, and please do it sooner than later, because as we discussed, don't wait till there's an emergency.
Once they start showing signs of any kind of dementia, they might not be able to do those documents. And we had a situation this week where we were contacted by a past client of ours who had been estranged from his father for about the last 10 to 15 years, hadn't spoken with him, and got a call in the middle of the night from a social worker at a hospital down here in South Florida, and my client lives up in Boston. So jarred him out of his sleep to find out that the father he hadn't spoken to in many years, his second or third wife, had passed away, didn't have any kind of will, and a neighbor had called 911 for the father who had fallen. And once the 911 came into the home, they realized that the wife who had passed had been the caregiver, and now this older gentleman was living on his own, could not care for himself, could not care for his home, and
so it was a disaster.
It was a disaster of a situation. And somehow they found his son as next of kin, reached out to him in Boston, and the son had to fly down and make sense of everything. The father was at the beginning stages of dementia, couldn't recall what medications he was on. They had to figure out not only the medical aspect of everything, but the financial aspect of him. Wound up his father had nothing. Again, the wife who passed didn't have a will, and it was a mess. And it's going to be a lot of
pressure
journey
on those that are left to make decisions.
It puts a lot of pressure on those who are left to make decisions for their loved one who they might not have known what their wishes are. And now it's not safe for his father to live at home. So he's now on that journey of finding an assisted living or memory care facility for his dad, determining whether keeping him here in Florida, taking him up to Boston is the right thing. How are they going to pay for it?
And a dad that he's been estranged from for 15 years. That makes it even more uncomfortable.
Exactly. And it just, my heart goes out to him. And luckily, we were able to provide him with a lot of resources to help on this journey, but it is so stressful. I was on the phone with him again today a number of times, and I can just feel through the phone what he is going through. And he literally said today, I'm just spent. I'm just done. He's been dealing with it all. So please, I know it's a difficult conversation to have with your loved ones or your parents or your grandparents.
Or your spouse.
And we're going to have a show about difficult conversations coming up. But it's so important to have those conversations early and have them now and make sure you are using an elder law attorney or an estate planning attorney and going to the right person. Please don't get your documents off the internet, but please have those conversations with your loved one, because what my client is going through now, I don't wish on anybody. And I know it's difficult, but please have those conversations with your loved ones.
And it's important. I think there's so much that are in the limelight right now for Alzheimer's and dementia. In fact, the month of June is the month to be more in tune to what's going on with Alzheimer's and Alzheimer's awareness.
Brain and Alzheimer's Awareness Month.
Alzheimer's awareness. And so we have so many, senior helpers is in so many of the communities. And I think one of the favorite things that we like to do within the memory care, which the majority of them have dementia, is our baby therapy. So our unique baby experience. And we have great moments. We have kind of sad moments where people cry. The recent moment that I have is one of my favorite gentlemen, and he's in a community, and his name is Al, and he doesn't really dig the babies so much, but he loves the fact that my name is Amy Decker. So that brings him, the minute he sees my name tag, it brings him to a memory of his best friends, Phil and Lil, up in New Jersey. So we have this entire rapport where I'll walk in with the babies and I'll hear, Amy Decker, come on over here. How are Phil and Lil? And I'll say, they're great. They ask about you all the time. You guys used to play cards. And the longer I play this game, the more I learn about who Phil and Lil were to him. And he'll lean back and say, oh, thanks so much for telling. You warmed my heart. He holds him. You warmed my heart. I feel so good about that. And it kind of makes me choke up a little bit when he does that, until he says, you know, Amy, you're kind of a big girl. And so do you play football? Because you're kind of a big girl. And I'm like, okay, yeah, I remember who you are now. But there's just so much personality. And I think one of my favorite things is to be with those that have dementia and Alzheimer's, because deep inside, they're still who they are. You know, I love to bring that out of them.
It's really nice to see that come out when they, you know, there's so much that they can't remember, but they say it's the older memories the easier they come out.
That trigger a memory for them. Yep. Mm-hmm.
And to see them holding those babies, if you've never seen these babies, please go to our Facebook page or our Instagram, and you can see some pictures of Amy with the babies. They are so lifelike. I've held one. It's really... It's not just a doll. It's an amazing
experience. Some people love them. Some don't want them. They're creeped out by them. And I know I've told this story before too, but we had a gentleman that was nonverbal, and he didn't move, kind of just watched me around the room with the baby. I put it in his lap, and he started singing to it because he was a retired OBGYN, and none of us knew that. So, you know, it's just a great little side piece that Senior Helpers likes to do in the communities, that we are the preferred home health company.
It's an amazing experience. So please go over to our Instagram or our Facebook and check it out and see what these babies are like. We definitely have some videos up there for you to check out. We have some great guests on our show today.
Looking forward to it. So we have Carole Hirsch, and we have Jeff DiLavore, and they're going to be coming up next after the commercial, just to talk a little bit about what they do regarding traumas with seniors, what they see more of,
how to prevent
those things. And then in Carole Hirsch's case, she's
with a company called
Prepare to
Care Emergency Companions. If you are listening to us and your loved ones are down here in South Florida, but you are not, you're definitely going to want to stay tuned to hear all about what Carole does.
Right, because she makes sure that you don't go to the hospital alone, and then helps you also to prepare for that in advance, so that if something does happen, you've got somebody in place to take care of your loved one. So that'll be next coming up, and we're really excited.
We look forward to seeing you after the commercial break.
with people and companies you probably never knew existed and never knew you needed.
We just can't wait for you to join us.
Come join us for some laughs and fun as we give you some tools to use.
See you soon. Hi, I'm Amy Decker with Senior Helpers.
And I'm Shayne Silver, a seniors real estate specialist with the Silver team at Keller Williams.
We are so excited about a new show that we're launching, Senior Strategies, Tools for the Caregiver.
We know that being a caregiver can be lonely and very overwhelming, and we want to help.
And so we hope to empower you with resources and tools that you probably didn't even know existed.
We'll be having some great conversations with people and companies you probably never knew existed and never knew you needed.
We just can't wait for you to join us.
Come join us for some laughs and fun as we give you some tools to use.
See you soon.
Are you considering selling your home? Are you considering downsizing? Are you considering a transition to an independent or assisted living community? Are you considering moving to be closer to your family? Do you need a home more conducive to aging in place? If so, you want to talk to Shayne Silver, co-host of Senior Strategies and Senior Real Estate Specialist. Shayne and her real estate team are extremely knowledgeable and experienced when it comes to helping seniors and their families make life's important transitions. Shayne will guide you every step of the way, making the transition as stress-free as possible. To schedule a no-obligation consultation, call 561-735-3030.
At Senior Helpers, our mission is to ensure a better quality of life for our clients and their families by providing dependable and affordable care. Our caregivers are not just certified in Alzheimer's, dementia, and Parkinson's care, but they can also help with light therapeutic exercise, in-home safety, fall prevention, transportation assistance, medication management, fresh meal prep, and personal care and companionship. At Senior Helpers, we help family members better understand the different stages of the disease and create the right kind of care plan customized for you and your loved one. For more information, contact us at 561-969-9990.
NPTU is a mobile pain management provider caring for patients in their homes or skilled and assisted nursing facilities. NPTU can help with prescribing medications, joint and spine injections, under ultrasound guidance, with a specialty in neurostimulators. Neurostimulators can help reduce the need for narcotic pain medication and are covered by Medicare with a secondary insurance at 100%. NPTU and Tracy Leshinsky is the only provider of this device within a 250-mile radius. Services Palm Beach and North Broward counties. Contact NPTU today at 561-901-1182.
Welcome back to Senior Strategies with Amy and Shayne. Coming up next are more tools and resources you will need to make your journey of caregiving a little easier. For more information or to be a guest on the show, please contact us at 561-800-6654. And now, on with the show.
Welcome back to Senior Strategies with Amy and Shayne and our guests. And we're really excited for you to meet our guest. We're gonna interview at two different times. And so Shayne, why don't you introduce the guest that we have here?
Our first guest tonight is Jeff DiLavore. He is the Trauma Injury Prevention Coordinator at Delray Medical Center. He is also a registered RN, and I'm so excited to have him with us tonight. Jeff, please introduce yourself to our audience.
Thank you, Shayne and Amy, so much for having me here tonight. My name is Jeff DiLavore. I'm a registered nurse, as you heard already. I am a transplanted New Yorker who's moved to Southern Florida.
That's bizarre. We don't have very many of those.
No, not many at all. No.
Any of those.
I moved here early last year, and I continued my career in nursing outside of the ER area, and I had this tremendous opportunity to become the injury prevention coordinator at a level 1 trauma center, which is what Delray Medical Center is. And I love it. It's allowed me to connect with a lot of the older, the senior citizens, or seasoned citizens, as one of my
That's a good one.
I like
as,
that.
as one of my as one of my proteges has taught me, and it's allowed me to take what I've learned over a career in emergency medicine and in trauma medicine to teach people how to be safer in their everyday life. And it's been nothing short of spectacular since I've been here.
I bet.
Connecting with older folks is something that I've always loved to do, and being on this side of it now, rather than seeing them when they come in with the severe injuries that we saw from the falls and from the other things that happened to them, to be able to kind of raise the level of awareness and help them to prevent those injuries is so much more rewarding now. So I love what I do. I love being a nurse.
You can see it.
Yeah.
Yes.
Oh, it's so much fun.
Passion.
And that's why when you guys invited me on the show, I was so happy to be able to come on and be able to spread the message.
Good.
Thank
Good.
you for being here.
Thank you.
Tell us a little bit about the program.
So Delray Medical Center is a level 1 trauma center, which means that we provide the highest level of care to someone if they suffer traumatic injuries. Demographically, South County in Palm Beach County has an older population. And nationwide, the #1 cause of traumatic injuries is falls. A lot of people may think it's like motor vehicle accidents or motor vehicle collisions or victims of violence or assaults or whatever, but it's actually falls. And I'm not a numbers guy. I'm more of like I like to put my arm on your shoulder and say, hey, listen, this is what we need to do not to fall. But the numbers are so important when it comes to this. Nationwide, falls occur 75% of the time when somebody has a fall, it's in or around their home. So what I do is when I go out and teach people, or I give lectures, or I have conversations with people, I try to talk to them about how they're safer in and around their home. It's 77%. Only 23% happen if somebody's at a mall or at a shopping center or something like that. So, and in Palm Beach County, we're no different. Our numbers are going up consistently, and that's something we don't like to see. So this year alone, our traumatic numbers are up 7%, even over last year.
Wow.
Yeah, and our falls numbers between ourselves at Delray and at St. Mary's Medical Center account for about 47% of the traumatic injuries that we see.
And traumatic meaning brain, broken hips.
Correct.
Like those types of things.
Correct.
Okay.
Anything that classifies a trauma, there's a criteria that's set for the trauma centers by the American College of Surgeons. And it doesn't mean that if you are a trauma, you're coming directly to us. You may go to a different hospital because you live closer there, but they may recognize they need a higher level of care and then transfer them to us. But once they get to us, they are going to get the highest level of care. Something else that's very interesting too, people love to ask, they like, so who's getting hurt? And this is the one that makes everyone laugh. And I'm sitting on a panel with 3 women, so I know I'll get a chuckle. But
watch it.
No, you're going to enjoy this one.
I'm gonna like
you're going to like this one.
Like it.
So
okay,
62% of the traumas are men. 62% of the falls. 62% are men, and to 38% are women.
She's making a note of that.
38
notice the notes. Yeah. So what that means
what
is
does that mean? Yeah.
What that means is that women are right, men are wrong, okay, and we don't listen.
How do you get that in writing?
Well, you have it on.
We have it on tape.
It's protected forever on video.
Forever. That's right.
There we go.
But men predominantly are more prone to falls than women.
Really?
If you ask me to break it down why, I don't have that data, but that's what we see.
Interesting.
When I go out and I do that, I try to bring a little humor to my lectures to try to break it up. Because what I found is my older friends, nobody wants to be preached to or
Right.
lectured to.
Right.
You guys brought up some really good points in your opening too. I like to have conversations. I like to just kind of raise the level of awareness. These folks lived long and productive lives. I'm not here to teach them anything new, just to remind them of a few things.
And to be able to live a long, rich life.
Right,
and not have an
exactly.
injury that's going to cause them to be disabled for the rest of what they have left.
Exactly. And one of the best things I tell them is, I'm like, you know, you earned your retirement here in beautiful South Florida.
Yes.
You know, so, you know, the biggest thing there's three things I tell them. Slow it down, okay? Take your time and talk to your family members. You guys raised that issue in your opening.
Do you go into their homes at any given time just to look to see what's going on in their home?
I don't, but it's funny you brought that up because just today I had a meeting at the healthcare district up in Palm Beach, and that is what our friends at Fire Rescue do. If they have calls where they go in and someone has an injury, they may or may not transport them, but they have a program in place where they will then go back and do evaluations where they will educate these folks, and they'll do an inspection of the home, and they'll see, are they safe in their home?
Right.
And they'll identify things that might make them
And
unsafe.
that's most important because they can put a report together then. Even
Right.
at Senior Helpers, we go in and it's a personal home profile. We'll look where the rugs are the rubber backing on it? Is the step too high? Is something broken? Where is the medication placed next to cleaning supplies? We plug and play the whole report, and then you print it up and say to the family, to keep your mom and dad safe at home, you got to fix all these things. And I think the fire department does do the same.
Correct.
And something like falls seems like it would be something that could be easily avoidable.
Yes. Yes, it is, and to us, it seems that way. But you know what? We all make mistakes,
Right.
And that's how I kind of approach it. We have a six-step plan. My counterpart and myself, the person who has my job, my good friend and my colleague Elijah Virgin up at St. Mary's Medical Center, we got together and we developed a program that we kind of pitch when we go out to these communities. And we took something from the National Center on Aging, and it's 6 steps or 6 things that we present to our senior friends. And it's really a pretty simple thing. The first thing we tell the folks is find a really good balance and exercise program. We don't tell them they have to go join Planet Fitness or LA Fitness or anything like that. Something that just finds where you can get a little bit more flexibility in your life, and just keep yourself a little bit more agile. And that's where the Tai Chi
core
comes
strength,
in.
right?
Right,
To keep
core
you from
strength is
tripping. Yeah.
right, exactly. The second thing is talk to your healthcare provider. That's so important.
Communication.
As we get older, and I'm finding this out now too, because nobody's more stubborn than me.
I am.
But we have to talk to our healthcare provider and let them know. Listen, when I bend over now to pick up the laundry or something, I really don't feel that steady now.
Right.
And we have to kind of own up to the fact that maybe we're not capable of what we were once able to do.
Yep.
That's where the stubbornness of the men come in and the high number of men with trauma.
Because they don't know when to admit
I'm
it.
going to say that.
I'll agree to that.
Denial.
I will agree to that.
Denial.
Yes, exactly. But as you guys probably know, I mean, it's difficult to sell that to some people.
Of course, I'm sure.
And it's a very delicate balance. So that's number 3. This is huge. I mean, it's so big because it's so broad ranging. It's reviewing your medications or talking about your medications with your doctor. And I'll give you 3 quick examples. Right. You could be on a blood pressure medication for 20 years. If you change your dose, your doctor says, we're going to try going 5 milligrams up or down. That could have a significant effect on you. If you take a diuretic and you take it too late at night, that's going to cause you to wake up in the middle of the night. When you wake up in the middle of the night, your chances for a fall increase because you're ambulating when you're not typically ambulating in the dark without your glasses, etc.
Right.
And then also like sleeping pills or anything else that like anti-anxieties or anything like that alter your sense of perception or anything like that.
Wine.
So
Yes.
yeah.
Wine.
Yes.
Too.
Well, we can go to alcohol too. That's a good one. But then, so those are just
prescribe that though.
so medications are so very important. I
Right.
tell people,
Yep.
take advantage of the resources you have available when you go to your doctor. I kind of developed this thing where I tell them, have a doctor's shopping list. If you're going to go to your doctor and it's the general practitioner or the cardiologist, in advance of that, put it on your refrigerator. Write down, what do I have to talk about the cardiologist
Yes.
with? What do I have to talk about the
Make
orthopedic?
lists when your mind is clear,
Right.
so you can think about it versus
Exactly.
getting panicky and then you
Right.
forget. Yep.
The last three things are simple stuff. Hearing and vision. We should be getting our hearing and vision checked at least once a year. And if your vision is, or one or the other is bad, maybe even more than once a year. That's so important. We develop
that's also
balance
another thing there,
issues
too.
if we have inner ear problems as we get older.
Yeah.
And our eyes, if we're not seeing well, we can't see obstacles in our
Right.
way.
That's
So
true.
that's so important. The next thing was keeping your home safe. I mean, I could do a whole hour lecture on how you
bet.
keep your
Yeah.
home safe. And you
Cords
guys
and rugs
touched on a
and-
few of them.
Yes.
The cords in your house,
Yes.
having grab rails in your shower. I
Yes.
tell people, go a step further. Get a shower seat. Sit down in your shower.
Or
you
they
know?
get the shower bars that are suction cuppy. Those don't
Right.
work.
No.
You've got to get
Right.
the ones that are screwed in. But they might have the right ones, but then stand on a rug that's got the slippy underneath.
You know,
they're going to slip and fall on
my
that.
grandmother, God rest her soul, she loved her runners too.
Oh,
the
yeah.
carpets in her house.
Yes.
And she was a little 4'11" Italian woman. She was small but mighty, but she loved her carpets. And I tell people, you can have them, they look beautiful, but do them safely. Make sure they're backed with rubber so they don't
Right.
slip when you
Right.
step on
Yep.
them. And if the corners start to curl, make sure you secure them down.
Yes.
Because most people are going to trip over them, and that's where we're going to have trip and falls forward, and we're going to have slip and falls backward, where we're going to have head
right, the
injuries.
back of the
So
head.
that's dangerous.
Right.
So
Yeah.
when someone does experience a trauma, right?
And they end up at Delray Medical Center
Yeah.
with you.
That is where I want to bring in our next
Carole
guest, Carole
Did we run out
Hirsch.
of time because he didn't get to number 6?
Well, we're still going to talk.
The last thing on thank you, Carol. Number 6,
She's waiting.
we covered a few times, and it's huge. It's a great segue for you, Carol, is to talk to your family members.
Yes.
Have the conversation.
Prepare.
Keep the line of communication open, because as an ER nurse for so many years, the number one thing I saw was regret. And then that
Yeah.
went two ways. By the patient in the ER who said, I wish I would have told my kids or my niece, my
Right.
nephew.
Aw.
And from the family members, from the kids who said, I wish I knew about what was going on with mom and dad or with my aunt, uncle, whatever. So.
Good. So go ahead, introduce her.
So Carole, can you please tell everyone what you do and who you are?
Yes.
Other than you're a very good friend of ours.
Yes. And I'm
And
so
thank you for
excited to have
supporting
you
us
here.
on this show and even having a commercial that runs on the commercial.
You know, I gotta tell you, it's mutual. I mean, I did it because I love you guys and what
Aw.
you do in the community.
Thank
Absolutely,
you.
absolutely.
Thank you.
Yes. So I actually really started my business from the standpoint of wanting people to have communications with their family members. So, you know, I moved here in '94 and lived with my grandma, and my grandma had colon cancer, and she didn't want to have the colon cancer surgery. And I said to her, you know, she said, everybody that I love is gone, there's nobody for me to talk to, I can't hear, you know, all these things that were weighing on her. And, you know, my reaction, because I adored her, was, you're just saying that because you don't feel good. If you felt good, you know, you would want to live.
Right.
And we're going to have this surgery, and you're going to feel good. And so we had the surgery, and then 2 years later, she ended up getting some scar tissue, and it was wretched. I mean, it was really a horrible experience for her. And she said, you know, what did I do to deserve this? And I looked at her and I said, Grandma, you didn't do anything. I loved you too much. You know, that's why you're here.
Sweet.
And I think it's really normal that if you don't have conversations when you're not sick, you know, it's very hard to say, yes, it's okay, we're going to let you be comfortable, we're going to have a natural death. And so, yes, having those conversations are critical, and I can elaborate on that when we come on the other side of the break? Or
No,
am I
no,
too soon?
Yep.
What
we
was
just
it, 3?
We got 3 minutes.
Oh,
No,
3
we're
minutes.
good.
I
We got
can,
3
okay.
minutes. So
I
go
can
and then
really
you'll
talk.
come back
Right.
after.
Okay.
So please, explain to the audience what you do.
Yeah,
So what I did,
because of your past experience.
because of my
Yes.
past experience,
right.
I started a business. It's called Prepare to Care Emergency Companions.
Which you will see on the commercial break.
So, and the goal of the business is for family members to be able to have those difficult conversations ahead of time so that nobody has to go through extensive amounts of care that they're not really wanting. And the other part of that is to make sure that nobody goes to the hospital alone, or that if you go to the hospital, that you are prepared. So one of the things that I do is make sure that everybody has their critical medical information all organized. When you go into the ER for the first time, the doctor has never seen you before. It's not like you're going to your family doctor. So you need to have your information prepared so that you can be helpful to them, so that they can direct the care to you. So I help people get their stuff all organized, and I help people make sure that they understand what happens at each transition, so that they can get the best possible care. So I am a board-certified patient advocate, and a board-certified patient advocate is somebody who always is interested in patients getting the care that they prefer and that they are entitled to. And that's what that's when you have these conversations, when you take time to get yourself prepared, you're able to get the care that you prefer and the care that you are entitled to. And so I don't know where else you need me to go with this.
So do you go through, so when you say you go through the paperwork to make sure that everything's, so do you end up then possibly at sometimes meeting with an elder law attorney to make sure that their power of attorney, their healthcare, do you go to that extent or not really?
Absolutely. So I actually can't sign anybody up in my practice if there isn't a decision maker set up.
Good.
So everybody has to have a decision maker. Everybody has to have those conversations, and it helps me to be able to support what is healthcare choices when all of that stuff is put down in paper ahead of time.
So you're not making the decisions, but you're that intermediary who maybe if their children are not local, you're there in the hospital with them, actually talking to the doctor and maybe relaying that information.
So absolutely. So I will say that as a board certified patient advocate, or anybody really helping anybody, you are not entitled to make any decisions or give any consents. And so what you are is a conduit of communication. So you are the boots on the ground. When your loved one calls the hospital and wants to try and talk to the doctor and can't reach anybody, when you have somebody in place, that information gets transferred. And so people know what's going on. They know when they have to friggin' get down here and when they don't have to get down here. So that information is
because that can be confusing with the hospital. They may make it sound like it's a dire emergency when really it's not. They have a little bit of time and you've got it all. You're like the general contractor.
Yes.
Making sure all the pieces are put together.
Yes.
Good.
And it's really important because, I will have their list of medications. I will have all of that stuff.
Know who their doctors are.
Know who their doctors are, all of those things.
Okay.
All organized.
Well, we're going to talk more about that after our commercial break because we've got lots of questions actually for both of you.
Please join us after the commercial break for more.
Hi, I'm Amy Decker with Senior Helpers.
And I'm Shayne Silver, a seniors real estate specialist with the Silver team at Keller Williams.
We are so excited about a new show that we're launching, Senior Strategies, Tools for the Caregiver.
We know that being a caregiver can be lonely and very overwhelming, and we want to help.
And so we hope to empower you with resources and tools that you probably didn't even know existed.
We'll be having some great conversations with people and companies you probably never knew existed and never knew you needed.
We just can't wait for you to join us.
Come join us for some laughs and fun as we give you some tools to use.
you considering selling your home? Are you considering downsizing? Are you considering a transition to an independent or assisted living community? Are you considering moving to be closer to your family? Do you need a home more conducive to aging in place? If so, you want to talk to Shayne Silver, co-host of Senior Strategies and Senior Real Estate Specialist. Shayne and her real estate team are extremely knowledgeable and experienced when it comes to helping seniors and their families make life's important transitions. Shayne will guide you every step of the way, making the transition as stress-free as possible. To schedule a no-obligation consultation, call 561-735-3030.
At Senior Helpers, our mission is to ensure a better quality of life for our clients and their families by providing dependable and affordable care. Our caregivers are not just certified in Alzheimer's, dementia, and Parkinson's care, but they can also help with light therapeutic exercise, in-home safety, fall prevention, transportation assistance, medication management, fresh meal prep, and personal care and companionship. At Senior Helpers, we help family members better understand the different stages of the disease and create the right kind of care plan customized for you and your loved one. For more information, contact us at 561-969-9990.
NPTU is a mobile pain management provider caring for patients in their homes or skilled and assisted nursing facilities. NPTU can help with prescribing medications, joint and spine injections, under ultrasound guidance, with a specialty in neurostimulators. Neurostimulators can help reduce the need for narcotic pain medication and are covered by Medicare with a secondary insurance at 100%. NPTU and Tracy Leshinsky is the only provider of this device within a 250-mile radius. Services Palm Beach and North Broward counties. Contact NPTU today at 561-901-1182.
Welcome back to Senior Strategies with Amy and Shayne. Coming up next are more tools and resources you will need to make your journey of caregiving a little easier. For more information or to be a guest on the show, please contact us at 561-800-6654. And now, on with the show.
Hi, welcome back to the show. We've got some great guests and great conversation. We were talking with Jeff DiLavore, who deals with trauma in Delray Medical Center and preventing it, and Carole Hirsch, once they end up at the hospital, how she takes care of them. So she's got a few tips and things that we can still talk about. So we can discuss that together.
Welcome back, and thanks for joining us.
So, whether you use a service like mine or whether you make sure that you have contracted with a buddy, because nobody should go to the hospital alone, and nobody, it's not like you have to pay for the service. You just need to make sure that you get that prepared ahead of time. But you need to understand the environment that you're in when you're in the ER, and that there are risks in that environment. You can fall when you're in the hospital. Yeah. You can have medication errors in the hospital. Mm-hmm. You can catch an infection from other patients. Right. You could have an incorrect diagnosis. You could be over-treated or under-treated. And then you're in you're in a very hectic environment. If there are many of the hospitals, especially a trauma center like Delray Medical Center, they'll have people that they're actually watching for suicide risks. So they're lined up in the hospital, in the hallways of the hospital, and then you're in a room, and it's very hard to get the attention of your nurses. So you want to understand that magnifies the opportunity for mistakes to be made or for important changes. Like if all of a sudden it becomes harder to breathe, or all of a sudden you're noticing your blood pressure is much higher, it's harder for nurses or doctors to manage those things when it's the hectic environment of the ER. So, you're going to say something?
No.
Okay. So it's important.
Well, that's what you do. You're like the extra set of eyes and ears then.
Yes,
for them to make sure those things don't happen.
Yes, because if anybody who comes to to the hospital will help to get you the assistance that you need, will help prevent you from falling because nobody's going to get up because they can't wait any longer. Somebody's going to help you to get on and off the bed or to make sure the nurse comes.
What's the ratio really between nurse and patient in most cases? Because the nurses really are bogged down.
In the ER, it's usually about 3 to 4 rooms to one doctor, but it could be more than that, and a different time if there is a significant trauma
Things
going on.
Yeah, you agree. So even like on the floor, do you find that?
On the floor, it's a different story.
But actually, the ER is.
But in the ER.
Yeah, the ER can change at a moment's notice. In the trauma bays, it's a little bit different, and that's really where I spend most of my time these days now. The trauma bays, there are 2 nurses on from the morning hours, and then 3 nurses on for the full day shift.
Eek,
So
only 2 in the morning?
No. But you have to put this in perspective, though. There's 2 nurses for 4 spots in the trauma base.
I see.
So, what happens is as the volume changes, you have availability of other trauma certified nurses that could then also kick in as well. Right. So, but it's different than the main ER. So
and you're mostly probably in the main ER, or it just depends?
I could be either way, but the point is that if you're in a trauma center, it's a higher level of care because they're worried about, a brain bleed or whatever. So they're really monitoring your eyes, they're monitoring your heart, they're monitoring a bunch of things. So it is a closer observation in the trauma center.
And that can happen so quickly. My father at 68 years old, healthy as could be, his Coumadin level was too high. They said go off of it for a couple of days. Walked in, kicked his boots off. His socks were a little wet from working. He slipped, hit the back of his head, and it killed him 11 days later. His Coumadin was too high. He had a brain bleed. They couldn't do anything about it. So those are the things that, look how quickly that can happen. Within 11 days, a healthy 60-year-old man is now gone.
Yeah. And if he would have gone to the hospital and, they need to know those things, because they are some things that can be done. So one of the things that we started to talk about, and I'm kind of directing it a little different direction because following the flow of conversation, but a lot of the people that we work with have dementia. And it's remarkable how many people with dementia will end up in the hospital when they don't need to be because it's hard to understand what is going on. And so
same could be the case even with Parkinson's, because sometimes they can't say what they need to say.
Yeah. So it's really, really valuable to have some care people in place, like you have a nurse practitioner who's advertising on the show.
Right.
Because when you can have somebody come and check and validate that this is actually a life-threatening situation, and you absolutely, with your dementia patient, take them to the hospital, it's because it's a lot of times because there's, you're so mystified or whatever, you just take them to the hospital. And so, and then when a dementia patient gets to the hospital, there is an extra level of care that needs to be in place. Like you really shouldn't leave a loved one overnight alone. The sundowning alone is, really.
And I have to say, any of our clients with senior helpers, if they have dementia and they end up going to the hospital, the aide immediately knows she's got to go with them and stay with them till the next shift. We never ever leave them alone. It's the same thing.
I can only imagine because my mother has Alzheimer's, which is a form of dementia, and anytime you take her out of her routine or the
comfort zone,
I mean, everything changes and everything goes on high alert, and it affects them 100 times more than a normal person that doesn't. So it's so critical.
And you as a family member, like I have one client that I take care of who, when she's doing like this, I know she needs to go to the bathroom. I know that she,
right. You know the body language.
Right.
Yep.
Wow.
And she might be doing something different, but I know what that means.
Right.
And so it's, you in a hospital, you have 12-hour shifts. You never, it's like, you always have a new person coming in and looking at that person, but every one of those people needs to know when my mother does this, she's trying to tell you she has to go to the bathroom.
I didn't even think about that. Because my mother has a form of Alzheimer's where she obsesses about things, right? So when we're not in the facility that she lives at and she's not in a comfortable place, after about 20 minutes of wherever we are, whether it's my house, a restaurant, whatever, she'll start asking who's taking her home, and I know that I've come to figure out that means I'm done. I want to get back to my comfort zone. And if I had taken her to the hospital or, a trauma unit, and she starts obsessing about that and asking about that, someone might not understand what that means.
Right.
I never even thought about that.
So that means you have to personally get to know your clients to know what this means or know what, hey, who's taking me home.
But I mean, this is a show for loved ones. So, you know how I feel about it. I have plenty of stuff. So this isn't a marketing opportunity for me. This is an opportunity to help people understand things so that they can have more positive experiences, because there's only so much that,
But that also goes to Jeff, because when Jeff is in the trauma center or his nurses are in the trauma center, they need to communicate with that patient, whoever they are, whatever they have. And if they can't communicate, that's where some of these issues and these overtreated, undertreated, getting the wrong medication may happen.
Right.
You know why it's so important.
Especially, it's like, you want a CAT scan for a patient with dementia.
Right.
Okay, what are you really going to do with that information? Right. So, you really have to have those, ask those questions, like, is this test necessary?
Right.
I have a crazy question, and this is probably for Jeff. So everyone says, or everyone, I don't know who everyone is, that you should keep a list of your medications in your wallet. Is that someplace when someone goes into a trauma unit, are they going to check, right? Because if they end up in there by themselves, right, maybe they fell and broke a hip and they can't talk to you. How do you get that information?
Do they know to look in the wallet?
That's awesome. Well, it's not so much in the wallet. A lot of people put them on their cell phones now. There are apps out there that you can use for it. Some people just put it in the notes on their phone. But there's a program that I push, and it's a cornerstone of my lectures. It's called the File of Life.
And I do that for everyone. That's exactly. It was one of the things that I didn't get to.
So the File of Life is wonderful because, and I actually have some here. I wish I would have had it. I could have held it up. What it is, it's a rectangular piece of plastic with a folder, and when you take this out, it's a trifold that unfolds, and it gives all the demographic information about someone: name, date of birth. Then it goes into emergency contact, doctor's names, all of that stuff. A list of medications, your medical history. Now, the best part about it is, if fire rescue comes into your home and you can't speak for some reason, you had a stroke, you're a diabetic, you're in DKA, for some reason you're not able to verbalize your needs.
Or aphasia.
All right? And you may have a neighbor who knows you very well, but they don't know your history.
Right.
They pull this out, and it's a snapshot of your medical background and everything else. So the best part, fire rescue can then start to treat you, bring you to us at Delray, hand that to us. Now, here's the best part. If you were at Delray before, we know your name. Maybe we know your daughter's name, your son's name, your nephew's name. We call them up. Hey, we got mom here, we got your dad here. What's going on? Oh, hey, dad's diabetic. This has happened before. Whatever. And it gives us
I think that's awesome.
A great leg up.
Yes.
So it is very helpful. So I push that. We give it out. And part of my lectures is that's what we give out. We know South Floridians love their swag. My swag comes with a purpose. And that's something that I like to give out to everyone.
So how could they contact you to get more information about what you do?
So I work in the trauma services department at Delray Medical Center. My office number is 561-495-3423.
One more time.
561-495-3423. And if anyone wants me to come out and do a falls prevention lecture, I do traumatic brain injury lectures as well. or just anything that's related to traumatic injury prevention, you can give me a call. We'll have a discussion. Other classes that I do also, that I'm really proud of, are the Stop the Bleed lectures that I do for our school teachers, our firefighters, our police officers as well too.
Nice.
Awesome.
And then you said you put together also a little.
Yeah, so I have a if people go on my website and they complete the intake form, I will be able to complete a vial of life, which I will put in a little plastic bag and put a little thing in there and magnet and stick it to the refrigerator.
That's great.
So that they have mine is not as fancy, but it is the form of a vial of life.
Information is information.
But it covers
Right, it covers all the same things.
exact same things. And the other thing that is really important, and it's probably not a topic for this show, but when we're talking about it, is whether people want a DNR.
Yeah.
And people don't know exactly what a DNR is, because a DNR is not advanced directives, and so many people think they have advanced directives, they have a do not resuscitate.
Right.
But a do not resuscitate is a yellow piece of paper.
That's gotta be on the
and
back
it's
of the door of the
signed by
fridge.
a doctor,
Yep.
which means that it's doctor's orders, and so the the emergency technicians can honor it, but they can't honor a legal document.
Where do they look for it to make sure
It's usually on the refrigerator
or the back of their door?
or the back of their door, or but it's notified
That's a
somewhere.
whole nother show we have to talk about,
Yeah.
because I think that's so
Yeah.
important. I know we've talked
So
about
important.
that before.
Yeah.
But we're coming to the end of our
Coming
show.
to the end, and we've had another great show. High five, high
Thank you
five,
both.
high five.
Thank
I
you.
have one little thing
Thank you.
I just have one little thing.
Yes.
Yeah.
In preparation.
Yes.
If you really think that you're going to fall, or that something could happen, you could have a little bag just like when you're pregnant, and it could have a pen
Good
and paper,
idea.
because you always need that in the hospital. Some clean underwear, your charger, some oral care items, some basic toiletries, non-skid slippers, athletic clothing, and
great
reading
idea.
material.
That is such a good idea. I didn't think of that.
Yeah. Like you
Would've
said,
thought
when
of
you're
that.
pregnant, you're prepared for it.
Yeah.
That, your little
See,
bag.
that's
Yeah.
why we have
Hospital
guests
bag.
like you on here to talk about
But
these
you
things. because
always
that's
need a
important.
pen and paper in the hospital,
Yeah.
because you want to make sure that you get
Yes.
all your
And
doctors.
And you always need a sweater. It's always freezing.
always cold.
Add a sweater to that list.
Well, we are so happy to have you on the show. We have a couple of events that we're going to be
Couple of
talking about. So
announcements.
go ahead.
Couple of announcements. So I want to remind all of our listeners out there that if you are local to Palm Beach County, the third Thursday of every month at 3 p.m., we have an in-person support group for caregivers and their families. It is at Allegro Senior Living in Boynton Beach. You can contact us. We will give you our email, our phone number. You can contact us for more information. We will also post it on our Instagram and our Facebook, so you have that information.
And if you want to attend, the next one is July
20th.
and you can RSVP to 561-424-3294. See, I
One
need
more
my
time.
Glasses.
One more time.
I got to get my dollar store glasses out. 561-424-3294. So that's if you want to RSVP. We also are holding a virtual dementia tour, which is very wonderful. Senior Helpers goes into different buildings and they put you through an experience of what it feels like to have dementia. They give you little jobs to do.
If you are caring for someone with dementia or have a loved one with any form of dementia, this was a life-changing experience for me. It really got to show me what my mother is living with on a day-to-day basis. It was eye-opening, it was very emotional, but if you are caring for someone or have anyone in your family, I highly, highly recommend it. Highly.
So we're going to be holding that at the Arden Courts in Delray Beach. The address is 16150 Jog Road. The phone number there that you can RSVP for the virtual dementia tour, it's going to be held between 10 a.m. and 3 p.m. is 561-498-5552. Again, it's 561-498-5552. That's the Arden Courts in Delray Beach.
And you do need to RSVP because they need to give you a time slot.
Right, exactly. And it is. They put gloves on your hands, they put things over your ears, they put prickly things in your shoes, and then they give you tasks to do. And then you
It's-
realize exactly what your loved one is going through, that you're aggravated with them and yelling at him and you're so slow and I have to repeat myself. And it really is
life-changing. But thank you all for being here tonight. Thank you for supporting us. We hope that you learned something. We hope that you, yes, go ahead. How do they contact you, Carole? How do they contact you?
I just want people to know about my website in case they want to do the Vial of Life.
Good.
So it's preparetocare.com. And my company is Prepare to Care Emergency Companions, and my phone number is 561-758-5630.
One more time. Real slow.
561-758-5630. And the website is preparetocare.com.
And we will have all that information for you as well on our YouTube and Facebook and Instagram for you as well.
Which is seniorstrategies.pb. Our Gmail is .pb@gmail.com, but our Instagram and our YouTube and everything else is seniorstrategies.pb. So you'll be able to watch little segments of our show tonight and learn what's going on to be on our next show.
Thank you.
Thank you
both.
again.
Thank you.
Thank
So
you.
much for being
This was
here.
so fun.
Thank you.
I feel
Thank you so much to our listeners. We hope you learned something. We hope we connected you with a resource you maybe didn't know existed. And we hope more than anything you know that you're not alone in your caregiving journey.
We look forward to seeing you on our next show, but follow our pages to get more information. Thank you.
Have a good night.
Bye-bye. Thank you for joining us today on Senior Strategies. We hope that you found the tools and the strategies that we offered you beneficial for your journey as a caregiver. We want you to leave today feeling empowered and supported.
Please follow us on Instagram, Facebook, and YouTube for upcoming shows and events. For more information, to schedule a consultation, or to join a support group, please contact us at 561-800-6654.
And remember the strategies
And tools you can use
to make your journey easier.